This is the Neurological Assessment for Health Assessment. So first we're going to assess your olfactory nerve, which is your smell. So if you will just close one ear for me, close your eyes. What do you smell? Alcohol. Okay. Now close the other ear. What do you smell? Coffee. Alright. Then the second nerve we're going to assess is the optic nerve, and we did this in the eye exam. So I would have an ophthalmoscope and I would look at her optic nerve, your red reflex, your disc, the vessels, the retina. I would look at all that just like you do in the eye assessment. Then we're going to assess the oculomotor, trochlear, and the abducens cranial nerves. So first we're going to go through the 6 cardinal fields of gaze. So I just want you to follow my fingers. Okay, and now I'm just looking at her eyelids, looking for any kind of drooping or anything like that. Then I'm going to get my pen light and I'm going to look at her pupils, just look at how they react, looking at their size and shape. Alright, that's normal. So next we're going to assess the trigeminal nerve. So we're going to do a sense of pain. So let me get my dull and sharp. If you'll close your eyes, just tell me if the pain you feel is dull or sharp. 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 Dull. Sharp. Dull. Dull. Okay. Also going to test your corneal reflexes. Okay. Next, we're going to assess the facial nerve. So just smile real big for me, frown for me. Okay. I'm just looking at her her facial nerve, and if she has appropriate reactions. Also with the trigeminal nerve, I forgot, I'm just going to look at her face for any muscular dystrophy, any jaw deviation. Clench your jaws for me. I'm going to palpate her jaws. And then I did the other. So after that, we're going to test the acoustic nerve. And you would do this with the tuning fork like we did for the ear assessment. I would go over the bony prominences and we would tell the difference between air conduction and bone conduction, how long she hears either one. And I'd also put it on her head and see if she has a unilateral sense of hearing. Then we're going to go to the glossopharyngeal nerve. So that is going to be if she can taste with the posterior third of her tongue, and she says that she can taste with all of her tongue. You'd also test the sides of her tongue with the facial nerve. We didn't do that. So then we're going to move on to the vagus nerve. So if you'll just open your mouth for me and stick your tongue out. We're going to test her gag reflex. Okay, she's got a gag. Then we're going to go to the spinal nerves, accessory nerves. So I'm just going to feel her trapeziuses. I'm going to feel her sternocleidoid mastoids, just size, shape, and symmetry. Shrug your shoulders. All right. So that's normal. And then last, we're going to do the hypoglossal nerve. So if you'll stick your tongue out for me, move it side to side, up and down. Okay. And then I want you to, I'm going to listen to her, assess her lingual with that nerve. Say ladder, door, now, truck. So all of that is normal. So then we're going to go on to the proprioception and cerebral function test. So the first one is going to be motor function. So what I want you to do is I want you to pat your knees and I want you to go back and forth. And it should just be like a clean motion, which she has. Okay, the next one is finger to finger. I want you to have your fingers out and bring them back in. Okay, and now close your eyes and do it again. All right, now we're going to do the finger to nose. So I want you to touch your nose and then touch my finger as fast as you can. And while she's doing all these tests, I'm just looking to see her motions, if they're smooth, if she's having anything abnormal. So now we're going to test her equilibrium. So if you'll just stand up for me, and I just want you to stand there with your eyes, or your feet together, your arms to the side, and your eyes closed. And I'm just looking at how well she has balance, and if swaying is a little normal. So I'm gonna push her a little bit and see if she can maintain her balance, which she should be able to, and she did. Okay, now I want you to stand on one leg, and I just want you to stand there. You should be able to do this on each leg for 5 seconds. Okay, now with your other leg, I want you to stand on it and hop. And again, she should be able to do that on both legs for 5 seconds. All right, now I want you to just like take a stroll, just walk normal. And then walk back with your eyes closed. Okay. And you just watch their gait, see if there's anything abnormal, any kind of shuffling, anything different. You can sit back down. So now we're going to look at her cortical function. So the first thing, I know I grabbed a coin. Is her stereogenesis assessment. And so what I would do is I'm just going to get you to close your eyes and stick out your hand. And I want you to tell me the object that's in your hand.
Pen.
Yes. Okay. And you would do that with both hands, preferably a key or a coin, which I brought a coin, but I don't know where I put it. The next one is going to be the 2-point discrimination. So I have tweezers. What I want you to do is I want you to close your eyes, and I'm going to touch the palm of your hand, and I want you to tell me when you feel if I'm touching with 1 point or 2 points.
1, 2, 2.
Okay. Next, it's going to be the extinction phenomenon. So what I'm going to do is I'm going to touch both sides of your face. Close your eyes for me. Can you feel sensation on both sides?
Mm-hmm.
And they feel the same?
Yes.
Okay. Alright. So keep your eyes closed, and then we're going to do the graphesthesia test. So give me one palm, and I'm going to write a letter in your hand, and I want you to tell me that letter.
H.
Okay?
B.
Alright. And then keep with your eyes closed. Just tell me where I'm touching you.
Arm. Knee. Shoulder. Nose. Forehead. Shin.
Alright. Next, we're going to test her superficial reflexes, starting with her abdominal. So you can just actually sit right there and just pull your shirt up for me if you don't mind. So they say for this you need to go up the quadrant to test the upper abs, down the quadrant to get tests the lower abs. So we're going to go up, and the unblock it should shift with the movement, the reflex. And go down. All right. I would test a I can't say it, chemostatic reflex on a male. I would stroke his thigh, and the scrotum and the testicles should move a little, or lift a little bit with that. And then we're going to test the plantar. So if you'll just take your foot off your shoe for me, off your foot. and just put your foot on, I'm just gonna hold it, and I'm gonna go down the lateral part and push up and then go across to the ball, and her feet should flex a little. All right, so now we're gonna go to deep tendon reflexes. The first one is gonna be the bicep. So you put your thumb on the bicep tendon, and then I'm gonna hit it, and it'll reflex a little. And then next is going to be the brachioradial. So just gonna, and she should have a reflex there, which she does. Now we're gonna do the tricep. Okay. Now the patella and the Achilles. All right. Also, if you'll put your leg up, I'm gonna look for ankle clonus. I'm just gonna bend it, and she has no clonus. If there was any abnormalities, I would get a monofilament and look at the bottom of her feet, touch it, and that would be touching for any kind of neuropathy or anything abnormal. That is the neuro assessment.